I appreciate you all coming. Ooh, I said y'all, that's Southern. I just revealed my roots, Biloxi, Mississippi. I'm going to talk today about this exotic agent called vitamin C. And interestingly enough, you'll look at the title called The Truth About Vitamin C. Well, it's entitled that because there's so much active and passive desires on the part of the pharmaceuticals and yes, even mainstream or modern medicine to ignore and sometimes actively suppress the truth about vitamin C. I'm not going to get too much more into the politics of vitamin C than that. They're discussed at some length in my book, Primal Panacea. But suffice it to say that the multi-billion-dollar pharmaceutical industry does not welcome and embrace something that could possibly, conceivably, take away 70 to 75% of their business if properly applied throughout the world and indeed in all patients. And I'll tell you why in a moment, why I say in all patients. Throughout this presentation, and incidentally, if you want a copy of the presentation, PowerPoint for yourself, my email is on the last slide, and you can just send me an email and say, please send me the presentation, and I'll be happy to send it to you by email. Because there is a lot of information on this that you can refer to later. In this particular slide, a lot of places throughout the presentation, there's a number. And if you go to the Pubmed website, click in, put in the number in the search box, click it, you'll go straight to the abstract and sometimes the entire article that gives you the validation of whatever that particular fact or assertion was. Now, a quick nod to the hat to Dr. Frederick Klenner, who basically started the ball rolling with vitamin C. It wasn't Linus Pauling. Linus Pauling kicked it into another gear, but it was Dr. Frederick Klenner shortly after Dr. Albert St. George discovered vitamin C and got the Nobel Prize, that somehow, and I still have not been able to figure out how, this country internist in North Carolina somehow decided in his own mind that giving babies, children, and adults with infectious diseases multi-gram doses of vitamin C was a good idea. I'm still fascinated to this day as to what he was thinking when he did that, but whatever his thought was, it was correct. Now, I'm not going to go through a lot of the detail in each slide. I just want to give you an idea, because many people, even those interested in vitamin C, say, well, why aren't they talking about it more? Why, aren't there studies on it? Yes, there's thousands and thousands and thousands of studies. In fact, vitamin C is arguably, in PubMed, the most researched agent in history. Okay, so when they say, show me a paper, there's thousands to show them. Now, what has it been already proven to do? Not suspected of doing, proven to do. It's been shown to kill or inactivate all viruses in the test tube against which it has been tested. Polio virus, herpes virus, Vaccinia, tobacco mosaic virus. These are all samples. I mean, there's hundreds, if not thousands. And enteroviruses, influenza viruses, and rabies virus. Okay? We have all these scare viruses out there, coronavirus, I'll talk about that a little later, Ebola, Zika. They're all different, but they're all the same. At least they're all the same in their susceptibility to vitamin C. So far. If one exists that's not susceptible to vitamin C, it's yet to be discovered or bioengineered. Now, that was in the test tube. What about in the person, in vivo? Vitamin C has been proven to cure acute polio. 60 out of 60 cases, which, as I like to say, is pretty close to 100%. Okay. Interestingly enough, Dr. Klenner, it was in the middle of a polio epidemic in North Carolina in 1948. And so lots of kids and babies are coming into the emergency room, many of them documented with spinal tap, so it wasn't just some non-specific virus. And Dr. Klenner found out through intramuscular and intravenous injections of vitamin C, he was able to cure 57 out of 60 in 3 days, and 3 more required 2 more days of treatment. But so within 5 days, he was able to cure 60 out of 60. And he presented this information to the AMA in Chicago the next year, to the lack of deafening applause, but he did present it. Now, also, you see down there, it's also cured advanced polio. In this one particular case, the little girl had flaccid paralysis, dead meat, for 2 weeks. And by continuing the vitamin C therapy for a longer period of time, there was complete resolution. Now, I'm not going to tell you everyone who has a paralysis from polio is going to 100% resolve. But I will tell you everybody with acute polio is going to be resolved. Now, also, Klenner found that oral vitamin C, just push the dose higher and take the dose longer, and you have the same effect. And this is an important premise to remember about vitamin C. There's a lot of different forms. There's a lot of different agents available, a lot of different ways to give it. The bottom line is, by whatever route you take, if you get enough vitamin C in the area, in this case, where the infection is, you resolve it, at least in the case of a virus and in the case of most bacteria. Now, acute hepatitis, and I emphasize the word acute. Chronic is a different story. I'll mention that briefly, but chronic, the virus, like in AIDS, in Lyme, it effectively hides itself. It's just not sitting there on the surface, in the extracellular fluid, in the blood. It gets deep inside the cells. And although vitamin C has and can resolve those syndromes completely, it's much more difficult and it's not as predictable. But in the case of acute hepatitis, that's just as curable as the polio. And for people that like formulas, what Dr. Klenner did was give 500 to 700 milligrams of vitamin C per kilogram of body weight every 8 to 12 hours. And he would also give oral, okay? And this is important. A lot of people think, well, if I have access to the IV vitamin C, that's the ultimate, I don't need to do anything else. No. Take as much in as many different forms as possible, unless you're getting better already. But if you're looking to get the optimal response from vitamin C, take as much as is available to you economically in as many forms as possible. And you'll be surprised at the results. Now, amazingly enough, Klenner even found that he reported on 8 to 12 patients who presented to him with viral encephalitis and they were already in a coma. And even at the point in time where they were comatose, vitamin C brought them out of their coma anywhere from a few hours to 24 hours to complete resolution. The only time vitamin C is going to fail you with a viral syndrome is when, as I said, it's a hidden virus. It gets into an area where the vitamin C can't physically access it, or you don't take enough of it for a long enough period of time. Other than that, no virus yet, let me repeat that, no virus yet has been found to be resistant to vitamin C. None. For those of you who haven't seen it, I was back in 2009 or 2010 in New Zealand. Have a video on the New Zealand farmer who was in the ICU with swine flu, and they were getting ready to pull the plug, and the family wouldn't take no for an answer. You know, I got to take a little sidebar here. Oh, that begets my attorney side, sidebar. Everybody likes to think their doctor's a good guy. Well, if you have a doctor that refuses to give your loved one vitamin C on the intensive care unit, and then your family member goes ahead and dies, was your doctor a good guy? No, your doctor was guilty of negligent homicide. And that's how profoundly effective vitamin C is often in these cases. And it's something, let me point it out right now. There's no problems with expense, if inexpensive. You can argue whether how effective it is, and it's non-toxic. All this stuff about kidney stones, pure BS. Vitamin C dissolves kidney stones. It doesn't form them. Vitamin C does break down to oxalate, and most of your stones are calcium oxalate. And then everybody concentrates on the oxalate. Hey, what about the calcium? It's the calcium intake, the dairy, the calcium supplementation that predisposes people to kidney stones and all other stones throughout the body. It's not the vitamin C, okay? Having said that, so vitamin C is not only safe, it's probably the safest thing you can ingest on the planet. Now, does anybody think water is toxic? Probably not.
Depends what's in it.
I'm talking about the purest of water. I mean, nothing but H2O, okay? Now, if you can take enough of something for it to kill you, I think you got to call it toxic. And you can do that very reliably with water. You can drink several gallons in a half an hour, go into cerebral edema, have seizures, and die. All you did was drink water. That means water, if you want to take an exaggeration, is toxic. There is no defined level of vitamin C intake that's going to cause toxicity. Now, things that's already been proven to do: cure measles, cure mumps, cure herpes infections, acute, and rabies in animal studies. Okay, they obviously rabies causes such a scare. There's no way you're going to get together a series of patients with rabies because they're all going to get the vaccine and everything else. But in animals, rabies is just as susceptible as a virus to the vitamin C as anything else. Now, so also in non-viral infections, all these have been found to be cured, not made better, cured by vitamin C. Don't be afraid to use the four-letter word cure, especially if it applies, because you're doing just as much damage not using the word cure when it applies as you are in avoiding it. If you have something that's going to reliably cure something, but you don't want to be perceived as a radical, oh, they're saying crazy things, I'm saying crazy things, you're doing more of a disservice by not letting somebody know what they have available to them and being afraid to assert the full extent of the truth, if you will. So vitamin C has been proven to cure diphtheria, tetanus, staphylococcus, streptococcus, pseudomonas. All of those are some of the most difficult infections there are that modern, quote-unquote, modern medicine tries to deal with today, okay? And of course, well, I'm not going to be anti-antibiotic. Antibiotics have their place, but not before vitamin C. Sometimes when you're having a slow response to vitamin C, using the appropriate antibiotic, you get a quick accelerated response for whatever infection you're dealing with. And that's fine, okay? I'm not anti anything except something that's not documented by science. Okay? I support science. All right. Some people say, well, you believe in vitamin C. Believe? No, that's a religion. I don't go to some altar of vitamin C and worship or take communion. I have a stack of papers and a ton of clinical experience that I know what vitamin C does. I don't need to be convinced, and I just do my best to try to let as many other people out there, let them know what's available to them. So vitamin C is what I would call an absolute viricide. Side means kill. So technically a virus is not alive, so it's inactivate. Whatever you want to say. Destroy, inactivate, kill, that's what it does to viruses. It's often bactericidal. So for many bacteria, pathogens, it will kill them. It's almost always bacteriostatic, which means causes the pathogen to stop growing, and then the immune system can kick in and mop up things after that. And this is important. It's always strongly supportive of your immune system. I cited in my book, Curing the Incurable, at least 20 different ways documented in the literature in which vitamin C supports and strengthens the immune system. And let me give you a quick aside here, because I don't think I have this covered elsewhere, but the evidence that I've seen, and this is my conclusion, okay, this is not in the literature per se. The evidence that I've seen indicates to me that the primary role of the immune system is to deliver vitamin C where it's acutely depleted. When you have an acute inflammation, the characteristic of that inflammation is to completely metabolize and use up all the vitamin C through oxidative stress wherever that inflammation is. And once that oxidative stress goes up and the inflammation goes up, your immune system comes in as an immune response. And what's the first cell that shows up at that immune response? It's the monocyte. And the monocyte has 80-fold, 8,000% more vitamin C inside it than the blood. So it's literally a big package of vitamin C getting ready to be dispensed into the area of inflammation, reduce all the oxidized biomolecules, and bring the inflammation back down to normal. Now, I'm sure the immune system does many things, but everything I've seen indicates to me that when you have a lot of vitamin C on board, your immune system works. When you don't, it doesn't, and all gradations in between. It's been documented in non-viral infections. Look at these four here. Malaria, leprosy, typhoid fever, brucellosis, trichinosis, dysentery, trypanosomes. Malaria and dysentery. Think of the number of people that kills every year. Malaria and dysentery, okay? And vitamin C can protect you against both. As amazing, to me anyway, as all of that data is on vitamin C and infections, vitamin C is even more impressive as an antitoxin or an anti-poison. There's no toxin. I realize I'm making an absolute statement here. There's no toxin and no poison that vitamin C will either not neutralize or repair the toxic damage that was done. When they should eliminate the poison control center, because all that does is delay the proper therapy. Unless, of course, the poison control center wants to become enlightened and give people intravenous vitamin C as soon as they come in with anything. Now, the poison control center has a good role when it causes purging, so that if something was ingested orally, you get it out, take activated charcoal to bind up toxins before they get absorbed. But once the toxin is in your body, nothing comes close to vitamin C. Also magnesium chloride, but I won't be able to get into that today. Vitamin C for sure. What has it been proven to do? Proven to do. Block the toxicity of mercury, lead, chromium, arsenic, cadmium, nickel, vanadium, aluminum, fluorine, snake and spider venoms, alcohol. But I'm not advocating you get plastered and go get your IV and go out driving, although it would work. Barbiturates, toxic mushrooms, pesticides, strychnine, tetanus. Now, what? Yeah, absolutely. I'm going to go into the reason why in a few more slides as to why vitamin C does this. It also shows benefits in, I mentioned earlier, Lyme, AIDS, chronic hepatitis, but those are embedded pathogens. Common cold, very good. The thing is we sort of denigrate the common cold. Oh, you've got a cold. Well, guess what? In terms of viral load, a common cold is one of the worst things you could have because you have a ton of virus in you. So the only reason vitamin C may ever fall short is because enough is not being used. You're going to get better quicker if you take a few grams a day or a few grams several times a day, but you're not going to resolve the cold in a couple days unless you're taking 50, 75, 100 grams of vitamin C intravenously with or without large amounts of liposome encapsulated vitamin C. But you will get over it when you take enough. But the thing is a lot of people just say, oh, it's just a little cold. No, there's no little cold. If you have the symptoms of a cold, you have a ton of virus in your body. Tuberculosis, pertussis. Radiation toxicity. All toxicity, whether it's an oral toxin or radiation, causes this damage by increasing oxidative stress, and I'll talk about this in a moment. So the bottom line is, my Japanese colleague, Dr. Yanagisawa, who founded this Japanese College of Intravenous Therapy, was able to do a little bit of research after Fukushima and was able to show that he could dramatically decrease the radiation-induced damage in these individuals with a regimen of vitamin C and some other antioxidants and multivitamins. The next few slides are what I call the foundational slides for understanding the concept not only of why vitamin C works, but why it works in all diseases. We hear the term oxidative stress a lot, and basically it's when you have more pro-oxidants, more oxidized molecules in an area relative to reduced. Oxidation is when you have lost electrons. Reduction is when you have regained the electrons. Okay? Now, at the molecular level, this is electron depletion. I used to joke earlier that the best treatment you could give anybody, especially a little kid with an infectious disease, would be a teaspoon of electrons. Well, that's not available, readily available, I don't believe, but that's effectively what you're doing is you're not giving a teaspoon of electrons, but you're giving several pounds of something else that will ultimately result in the donation of electrons where they're needed. Okay. Redox biology, reduction oxidation biology. An antioxidant at the molecular, a nutrient at the molecular level is an antioxidant. Okay, so all quality nutrition boils down to how many different antioxidant molecules have I metabolized my food down to so that at the molecular level they can donate electrons to oxidized biomolecules. That's the quality of, that's what you're shooting for with any quality diet, is being metabolized down to antioxidant molecules. So reduction is when you donate electrons, okay? An antioxidant donates electrons. A nutrient metabolized down to the molecular level donates electrons. So those are synonyms. Antioxidant is a nutrient, molecularly and the other way around. Now, flip side of the coin, toxin. We hear a lot about toxins these days, and justifiably so, but what's not realized is that all disease, 100% of disease, has to do with your toxin exposure. Not 80%, not 90%, not 98%, 100% of your disease ultimately has to do with your unique toxin exposure, where those toxins are coming from, where they're getting settled into in your tissues, along with your hereditary predispositions. So, the defining property of a toxin is its ability to deplete electrons or take them away, meaning oxidize molecules. We hear the terms pro-oxidant, we hear the terms free radical, these sort of things. These are all synonyms. A pro-oxidant, a free radical, a toxin, they're all the same things. They're an electron-seeking molecule or a molecule causing electrons to be depleted. So, bottom of the slide, underline, toxicity and any symptoms of toxicity cannot exist unless electrons are being taken away from biomolecules, oxidation. Let's see, okay. I don't have a slide on this, so let me go into this for a moment. What do I mean when I talk about biomolecules? I mean any normal molecule in your body, in your tissue, proteins, sugars, fats, structural molecules, collagen, RNA, DNA, those are all biomolecules. Enzymes, those are all biomolecules, proteins. Now, when those molecules are in their normal state, normal meaning they're not oxidized, they have all their electrons, they function normally. If you have no oxidation in your body, everything functions normally. When you oxidize something, in other words, when a toxin comes along and causes electrons to be taken away from X, Y, and Z biomolecules, and those biomolecules become oxidized, they lose their function. Anywhere from a major reduction to a complete loss of biological function. That's disease. Disease is the preponderance of oxidation among your biomolecules. When you have Parkinson's, when you have fibromyalgia, when you have heart disease, when you have anything under the sun, the tissues and the cells that are affected by that disease do not have some sort of unique thing called Alzheimer's. They don't have something unique thing called fibromyalgia. All they are is they have an excess of oxidized biomolecules relative to reduced. So, technically speaking, yes, oxidative stress causes disease, but more accurately, oxidative stress is disease. When you're able to take the oxidation and reverse it, the disease goes away. Plain and simple. So, electrons are literally the fuel of life. When people ask me, and they ask me, well, so I have to take that amount of vitamin C. Is that what you're saying? I said, well, yeah. So, well, how long do I have to take it? I say, well, how long do you want to stay alive? And are you planning on eating every day for the rest of your life? Are you planning on trying to ingest something to support your health? Vitamin C, and this is not cutesy, this is literal, is the fuel on which every cell in your body runs. Because it's the supplier, it's the physical supplier. There are non-physical sources. It's the physical supplier of electrons that keep your molecules in the reduced state. When you go low on that, and you go low on that when there's too many toxins relative to antioxidants, you develop disease. And then a lot of people immediately start wondering, rightly so, well, how can it be that vitamin C Well, the first thing that got me to this was for many years I struggled with the idea, but I knew it to be a fact, was that large doses of intravenous vitamin C had and would neutralize the toxicity of whatever toxin somebody was poisoned with, unless you only started it 5 minutes before they were dead. If there was enough period of time to get things going, you're going to save the patient. And it didn't matter if it was this toxin or that toxin, a fat, a carbohydrate, a big molecule, a little molecule. And I said, how can vitamin C knock out the toxicity of any intoxication or poisoning? And I said there has to be a final common denominator by which a toxin causes toxicity. And in fact, that's the answer. The final common denominator by which a toxin causes toxicity is oxidation, electron theft. And when the toxin takes the electron away, then the toxin becomes chemically stable and no longer represents an immediate threat, but the damage has been done. You've oxidized biomolecules. Well, then some people might say, well, that's fine, but you know, some toxins kill you in a few minutes and others kill you in a few days, a few months, a few years. How could that be reconciled? Well, let's look at cyanide. Okay, you inhale cyanide, you're going to be dead in a few minutes or less. That's because the chemical nature of cyanide allows it to be inhaled, go in through the lungs, specifically due to its unique chemical structure, become affiliated and aligned with the biomolecules in the oxidative Krebs cycle, so that within a few minutes you lose your ability to metabolize oxygen and you die quickly. On the other hand, mercury in your mouth and elsewhere, you can accumulate that for decades until you finally start to develop your Alzheimer's, your Lou Gehrig's, your Parkinson's, etc. Okay? Your multiple sclerosis in particular. So a toxin, different toxins at different solubility, different size, different charge, attack different molecules. That's what causes the variation in disease. But the disease itself, I can't overemphasize this enough. I should say disease in parentheses. The disease itself, quotation marks, the disease itself is oxidized biomolecules. Where they're located, where they're concentrated, what organ, what area, that's your disease. Now, with that in mind then, I think we've established that toxins cause disease, and they cause it because they result in oxidation to an excess degree that your body is not compensating for effectively with enough antioxidants. Well, so if that's the model, and that's what I'm telling you the model is, what are the most common and most significant sources of these oxidation disease-causing toxins? Number one, way ahead of anything else, is infections. The infections produce endotoxins, exotoxins. All their metabolic byproducts are oxidized. So any oxidized molecule is also a toxin because it's looking to find more electrons. Okay? This is why, for example, when you fry food, that's not so good for you. It's because you oxidize the food before you even eat it. It's just the oxidation caused by the frying process that's really the unhealthy part. It's just unfortunate that those oxidized molecules taste so good. And number two is chronic pathogen colonization. Now, this might be a new concept to some, but I want to emphasize this. I mean, there's basically three different ways you have infections. Number one, you have a body-wide infection, influenza. You have virus everywhere. Okay. Number two is you have a focal infection, an abscess, an infected tooth. It's very focal and localized. Number three is you have a chronic pathogen colonization. You have pathogens that are just residing over a certain area of your body. They're not proliferating extensively. They're not getting resolved by your immune system. They're just staying there. They're just hanging out. Well, and the number one place, not the only place, but the number one place is in your nasopharynx and your oropharynx. And they're nasty because they're protected by biofilms. Biofilms, in a nutshell, are the structural matrix, the condominiums that your pathogens live inside and keep them from having access by antibiotics and other things. Remember, anything, vitamin C, antibiotic, you name it, that's going to have its effect has to have direct contact with what it needs to knock out. If there's guards, if there's layers of other structures, in this case, collagen and other things in the biofilm, unless you have something that can go in and dissolve that biofilm first, you're not going to have any success in resolving these things. And in fact, in the literature, it's acknowledged that there is no mainstream medicine pharmacological agent that's been documented to dissolve and destroy biofilms. So that's why this chronic pathogen colonization is so important, is because if all you're relying on is regular medicine to give you your best of health, you're not going to be taking the agents that can destroy these biofilms and allow these pathogen accumulations to continue. Outside toxin exposures, of course, iron status, iron, calcium, and copper. These are the three toxic nutrients. They're absolutely necessary for life, and they're also absolutely necessary for death. Calcium is only good for you at a very limited level of intake. Above that, it's one of the most toxic things known to man. It's a direct carcinogen, and it will promote oxidative stress and put you in your grave early and cause all that pathogenic calcification I was talking about earlier that vitamin C gets blamed for. Okay? Other thing is iron. Iron is also probably co-toxic in significance with calcium. And somewhere along the line, I have a whole big presentation on this, but I got to keep moving along here. Somewhere along the line, in the 1940s, some public health geniuses in the United States were looking around the world and decided that there was an epidemic of iron deficiency anemia, and babies and children in third world countries, completely malnourished, were dying of iron deficiency anemia. And they said, wow, we can't let that happen in the United States. So we started adding iron to all enriched, fortified food. It's the worst thing you could possibly do, and most people are iron toxic because of it. And to add insult to injury, and I have the video, no time to show it, most of this iron is added to your food in the form of metallic iron filings. It's the metal. That's like if you want chrome on your pizza, you just scrape a little chrome on it, okay? It's absolutely incomprehensible that this is the case, but it is. And shortly after I made my video, you're able to pull the metallic fires right out of the cereal or whatever it is you want to examine. A lady from Australia sent me an email, and she said, I saw your video on iron filings in the Total cereal. And she said, you know, it's interesting, I never understood this. I said, but I worked at a plant that made cereal here in Australia some years ago, and the last step of the process was they literally threw a cup of iron filings into the cereal batch. Now, don't think for a second that metallic iron is good for you. Don't think for a second any excess iron is good for you, but much less in the metallic form. This is why God created plants, as an intermediary to take something metallic and make it bioavailable. But having said that, you don't want any extra iron at all. You don't never want to take an iron supplement unless you have a documented iron deficiency anemia. I don't care how low the ferritin is, how low the iron is in the blood. If you have enough iron in your body to have a normal blood count, which is what consumes the massive amount of iron that in your body, you don't need iron, and you're just going to accelerate all your medical problems, especially heart disease and cancer, right along with calcium. Dietary toxin exposure. Let me just say this. Obviously, nutrition's very important, but there's so many things we need to realize about nutrition that, to me, get routinely ignored. And that is more important, believe it or not, more important than the choice of food is how well you digest it. Your biggest source of toxicity from food in the digestive process is what percent of your food rots and putrefies and proliferates these horrible pathogens in your gut, and what percent gets processed quickly and you pass it out quickly. Makes some people skin crawl, but I'll tell you right now, the perfect organic diet, poorly digested, is much worse for you than eating McDonald's every day but digesting it perfectly. The digestion is the source of the toxicity. Obviously, your optimal scenario is to learn these digestive principles so that you can eat an optimal diet and digest it optimally. And that has a lot to do with food combining. Big subject, but let me just give you the short story on food combining. In the early 1900s, Dr. Ivan Pavlov, a Russian or Hungarian physiologist, I'm not sure which, worked on digestive physiology. And he had experiments with dogs, horrible open dog preps with stomachs and that sort of thing. And he actually won the Nobel Prize. He put pure carbohydrate in the stomach and watched how long it take to pass the pylorus for the stomach to drain. Turned out pure carbohydrate took 60 to 90 minutes. Then he put in ground up meat chips by itself. Watched how long it took to empty. Took 3 hours. Much longer to process. Then he took carbohydrate and meat chips. Sound like a familiar combination? Carbohydrate and meat? Steak and potato? He put those two together. How long did it take for the stomach to empty? 8 to 9 hours. So you have a late night dinner, you're still metabolizing it first thing in the morning, which means everything else in your gut has come to a stop. The gut is a continuous tube. You stop it here, it stops here. So this promotes putrefaction of everything else that you've eaten for the prior 24 hours because it all has to do with speed. When you can have a bowel movement at least once a day, but preferably twice a day, and most preferably equal to the number of different times that you eat, you know, like a baby, eat poo, that's the way to go. That's when things are working normally. But we work, we have schedules, we get an urge, we suppress it, gotta wait till I get home, this, that, or the other. Next thing you know, you've traded your bowel into a horrible habit of not really going when you need to. Okay. Woody Allen had a incredible little saying, and he commented once, "There's nothing more overrated than sex and more underrated than a good bowel movement." There's a lot of truth to that. I don't know that sex is overrated, but definitely the bowel movement is underrated. And then finally, you have hormone deficiencies. I'm going to go very quickly through a lot of important stuff. I literally, on these presentations, I go to different countries and I might talk for 2 days for 8 to 10 hours. So, but I don't want to minimize important points. So let me just tell you in a nutshell, if your sex hormones and your thyroid hormone is not perfectly regulated, everything else is going to go to crap. Or everything else is going to be suboptimally controlled because they are the ultimate modulators of oxidative stress in your body. If you're below normal in estrogen, below normal for the men in testosterone, slightly below normal with thyroid, in a nutshell, your focal infections start to metastasize. That's when the infected tooth starts setting up shop in your heart. 100% of heart attacks are due to the colonization inside your coronary arteries of oral pathogens. Okay? I'm a cardiologist, that's my training. Not that any other cardiologist knows this or wants to use it in his or her practice, but I'm going to tell you right now, with the evidence that we have in the literature, it is absolute malpractice for a patient to have chest pain and not have their mouth evaluated. Absolute 100% malpractice. Very quickly, and you can draw out the conclusion for yourself. They studied 36 patients with known coronary artery disease. They had blockages in their heart, did coronary angiogram, and did a process called atherectomy. They roto-rooted out the plaque, and then they examined the plaque. Inside those plaques were 50 different forms, over 50 different forms of oral pathogens, viruses, fungi, bacteria, you name it. All the garbage you find in your mouth was way out there in your heart in the coronary artery. And it was present in 36 out of 36 patients. Again, very close to 100%. So, and conversely, people that had no coronary artery disease had no pathogens. So they were controls run and they weren't there. So let's put it this way. Well over 97 to 98% of heart attacks are directly caused by pathogens in your mouth. Well over. Okay. Don't forget this. You have family, friends. I mean, if your dad has got, even if he already got his bypass, he needs to get his mouth evaluated. He needs to get rid of the root canals. He needs to get rid of the chronically infected teeth that you can only discover on a three-dimensional cone beam examination of the mouth because it's asymptomatic. Abscessed teeth, believe it or not, are asymptomatic greater than 95% of the time. The one that hurt like hell, that's the rarity. And the incidence of these abscessed teeth is enormous. This is why people are sick, because they're chronically seeding their body, not just in their heart, but throughout their entire body, directly with the pathogens and with the toxins that are coming from these teeth. I mean, I know we all hate the dentist, but don't kill the messenger. That's just the way it is.
So what do we ask the dentist to do when we see our dentist?
Well, first thing you need to do is get the 3D cone beam examination, okay? You call it a 3D X-ray or cone beam. It's a machine that swirls around your head. All the implant dentists have it. Nearly all the root canal dentists, not that you want to get a root canal, have it. And many of the larger dental practices have it because they're beginning to see. And the thing is the endodontist, the root canal doctor, should welcome this because it's just going to give him or her more business because there's going to be more teeth that need to be worked on. Although the choice that should be made is extraction of that tooth, not a root canal. Okay. So your principles are minimize new toxins, neutralize existing toxins, excrete old toxins, resolve infections or contain infections, supplement optimally, address hormone imbalance. If there's another important factor, I don't know what it is, but there might be. So in a vitamin C protocol, your goal is to get as much vitamin C in the active reduced form where the disease is as possible. Factors, dose. Dose is important because it's like real estate. Like, what are the three most important factors in real estate? Location, location, location. What are the three most important factors in French cooking? Butter, butter, and butter. The three most important factors in vitamin C, dose, dose, and dose. You don't use enough, you're not going to get the result that you want, period. And so many articles in the literature use these incredibly tiny doses of vitamin C for X, Y, and Z condition, and then they have the gall in their conclusion summary to say 25 milligrams of vitamin C given daily did not affect, therefore vitamin C is of no value in this disease. I don't know if they're that stupid or if they just don't want to acknowledge their less than noble motivations. I don't know. So dose, route. We have oral regular, oral liposome encapsulated, intravenous, intramuscular. Take it by enema. You can inhale it. You can nebulize it. Many, many different ways to get it. Okay? Rate, you give it really fast, you get different results than when you give it really slow. Frequency, duration, type, avoid calcium ascorbate. Why? Calcium. You don't want calcium, okay? Now, you can have butter and cream. That's nice, huh? Butter and cream. They don't have that much calcium, believe it or not. And if you want to use milk in cooking, fine, but never, never, never routinely use milk as a beverage. That is a huge calcium overdose. Okay. Adjunct therapy, safety, I've talked about that. So dose, most small adults, small to moderate sized adults, when there's an acute infection, they need on the order of 50 grams. But you can, let's see, it's good like a small child, 25 grams, a moderate sized adult, 50, a large adult, 75, a really big 250, 300-pound guy, 150, 125. But it's not rocket science and it's not precise science. You're giving this and you're observing clinical results. If you're getting the clinical results you want, fever down, respirations relaxed, general vital signs improving, sense of well-being improving, you're on the right track. If that's not happening, you need more. The other thing too is how rapidly it can work. Remember I talked about toxins. Well, when you've had a snake bite, spider bite, some toxic bug bite, a lot of the toxins are circulating in the blood, okay? Now, if you can get the vitamin C to that toxin before it hits the tissue, you can get out of Dodge before the damage happens. And that's exactly what Klenner did. He was able to, not only with intramuscular, but there's another slide that shows one of his patients came in, and Dr. Klenner always had a routine in his office. The patient comes in, get him hooked up to IV vitamin C first, and then have him see me. Well, this one was so sick, he came straight to Klenner, laid on the examining table, and had a very low blood pressure. And the patient said, Doctor, I think I'm dying. Something bit me, I don't know what it was. Klenner actually pulled up in a 25 cc syringe, full concentration vitamin C, that's 500 milligram per cc. So he pulled up in a 25 cc syringe, about 10 grams of vitamin C. He stuck in a butterfly, and in Klenner's words, he gave it as fast as a 20 gauge needle would allow. And when the syringe was halfway down, the patient's eyes lit up and said, Doctor, can I be feeling better already? That's how quickly vitamin C acts when you get it in direct contact with the target. Liposome encapsulated, very well absorbed, no stomach upset, intracellular bioavailability. This drives me crazy. I talk a lot about liposomes. I've been with Live-On as a consultant for about 14 years now, and Live-On makes the Ultrian product. But I've seen liposomes do things that only IV could do before. And in every sense of the word, I like to call liposome vitamin C as an IV in a box. Now, if you're deathly ill and you have access, you just don't take one or the other, you take both. You be greedy, you take the IV and you take the oral and you take the liposomes. in a nutshell, again, a very big topic that I'm going to go over quickly, a liposome was created as an artificial cell. It was created in the lab to set up what was considered to be an artificial cell, something that was surrounded by a lipid bilayer, just like the same as the cells in your body, with contents. And in fact, your body communicates each cell to other cells in this fashion with exosomes, which are super, super tiny liposomes. They go from one part of the body to the other. They're so small that they'll pass through the pores in the cell wall and then either empty their contents or merge with the mitochondria and the other intracellular organelles, open up, and then deposit in there. But the important thing is, though, even though you're taking it orally, it gets inside the different cells of your body better than if you're taking the same dose intravenously and without the consumption of energy. That's the other big one. When you take it intravenously, you have to have an active transport mechanism to get it inside the cell, which means you're robbing Peter to pay Paul. You're using up energy to get an energy dispensing substance into a different location. Okay. Also, liposomes, the phosphatidylcholine has these other positive effects, antioxidant, atherosclerotic. Rate has to do with how sick the patient is. We talked about the patient dying. But there's other things that you can use vitamin C rapidly for when given rapidly is when you give it really fast, the body thinks you just got a bunch of glucose because vitamin C is derived from glucose in the liver, in those animals that can make it. And it's very similar to glucose. Matter of fact, it screws up the finger stick blood glucose levels. Okay, you have a lot of vitamin C, it's going to look like your glucose is through the ceiling. So, you give a lot quickly, and guess what? The body says, I just got a bunch of glucose, and the pancreas then secretes insulin to deal with that supposed huge surge of glucose. And this is in every way, I don't know if you're familiar with this therapy called insulin potentiation therapy. They use it mainly for cancer. They give patients tiny doses of chemotherapy drugs, give them a ton of IV insulin, drop the blood sugar way down, and then the cell walls become permeable, and they take up the drugs or the agents much more effectively so that you have less toxicity and more effect. And it's pretty impressive. But in this case, you're doing endogenous. You're not giving insulin, you're having the body secrete it. So that's one way in which you make vitamin C even more effective is when you're able to give it rapidly. What's rapidly? Rapidly is, 50 grams in 15 to 30 minutes. That was the case that I was telling you about, where you gave it IV push. Frequency is very important too. As important as dose is still extremely important, but when in combination with frequency. In other words, if I have 50 grams that I have to give to the patient, and I'm going to have access to the patient. Okay, obviously, if they're in your office, you got to give it all at once. But let's say you're in the hospital or the clinic, or the patient's going to be in your office for 8 hours. The best way is to give that in divided doses. Okay, is to start an IV, give a low-grade infusion, and then give a bolus every 3 or 4 or 5 hours. And even though the total amount is going to equal 50 grams, it's going to be much more effective for the body than if you give the 50 grams all at once in and out. Okay. You want to maintain blood levels, and you want to periodically spike those blood levels. That's the goal. Duration, well, at least for infections, when the patient is asymptomatic, don't stop. You continue the same vigorous applications of vitamin C for at least 24 and preferably 48 hours beyond the initial asymptomatic state. Okay? Otherwise, it's going to bounce back on you. Type, so much garbage out there now. Okay? Ascorbate is vitamin C. Vitamin C is not some sort of exotic complex inside food that has other co-agents necessary for its facility. It's very good to eat quality food. It's very good to take other antioxidants, bioflavonoids, rutin, quercetin, with vitamin C. The more the merrier. The more antioxidants, the merrier. But vitamin C is ascorbate. They actually have people out there that saying vitamin C is not ascorbate. Dr. Albert St. George said it's not ascorbic acid. And this is all pure BS. I don't know if these people realize what they're saying is bold-faced lies, or they feel compelled to say it to sell their product. So, and we have only about 80 years worth of literature showing all the fabulous things I've said about vitamin C being done with just ascorbic acid or just sodium ascorbate or just any form of ascorbate. Okay, I mean, some of these people, I don't know how they could, they're either the stupidest people on the planet or they have no problem sleeping at night. They'll even say, well, you know, you take too much vitamin C, you'll get cancer. I mean, that's about as profoundly stupid as you could be. Okay. Okay, this is important too. Sodium ascorbate, people worry about the sodium. People with fluid retention don't retain fluid due to sodium, they retain it due to sodium chloride. Okay, so you're not looking, they should rephrase the low sodium diet in the hospitals to the low sodium chloride diet. Sodium with other anions does not have the fluid accumulating effect. Calcium ascorbate, no. Potassium ascorbate shows some really good effects, but potassium is so toxic it could kill you in a New York second if you take too much. I mean, it's one of the things that they give in hospitals. The other thing they do is they do blood levels of potassium, so to make sure they're not getting too high. I mean, a high potassium will put you 6 foot under really quick. So even though potassium ascorbate in different applications is highly effective, I think it's best to steer clear of that form completely. I favor sodium ascorbate. Ascorbic acid is fine, but some people, you know, get acid, upset stomach with ascorbic acid. If you don't have a sensitive stomach, it's perfectly fine. But the best way to avoid that is go with sodium ascorbate as your basic form of vitamin C. And incidentally, it's the sodium ascorbate, that's the form of vitamin C that's actually encapsulated in the liposomes. Adjunct therapies, no need to avoid antibiotics. Vitamin C stimulates the immune system, increases B cells, increases T cells, increases phagocytosis, and increases antibody formation. But when it's not doing its job and you have the right antibiotic, add the two together. It's no problem. I mean, although an enormous amount of mainstream medicine is pure garbage, in my opinion, you still don't want to be a nihilist and just throw away everything that modern medicine has to offer, because they do have some good stuff. The thing is you have to do it scientifically based, all right? Anybody that just says, trust me, do this, be very leery. If they got a solidly scientific paper, clinical, properly done, to back it up, good case histories, and fine. But they don't have that with most of the things they use in medicine. I've got news for you. They try to impose that standard on alternative medicine while ignoring it themselves. All right, another big fiction, chemotherapy and vitamin C. We now have a whole ton of recent papers, all right? I don't advocate chemotherapy, but definitely if you're taking chemotherapy, take vitamin C as well, okay? It's been clearly shown, not equivocally, clearly shown to enhance the chemo and suppress the side effects. What more do you want, okay? You make the chemo better and the patient feels better. Okay. I actually started talking about the fact that vitamin C neutralizes chemotherapy, I don't know, some 15 years ago, because it's a toxin. What did I say vitamin C does to a toxin? It neutralizes it. Somewhere out there in oncology world, I think that got picked up, And like for about the past 8 years, the oncologists have just been chirping, no, you can't take vitamin C. It's like I should have shot myself for saying that. Okay, but suffice it to say, we now have the studies to show that just don't take them simultaneously. Just don't have them circulating in the blood at the same time, and you'll make sure that that precious chemotherapy stays maximally toxic. And not days apart, hours apart. Take one, point A, take the other a couple hours later. That's all you need. Multi-C protocol. I have and this is, you know, it's not practical for most people, but it's a good way to realize that there are many different ways to augment your vitamin C therapy. And these are the primary different forms. Oral liposome encapsulated, multi-gram doses of sodium ascorbate powder. Never underestimate the power of taking several grams of sodium ascorbate several times a day. It's cheap and it's worked forever for just about any condition you can imagine. So don't feel like you just have to, if you can't get it IV or you can't get liposomes, you should give up. No, there's a lot of power to be done taking ordinary forms of vitamin C. Then we have all sort of variations on the IV, intramuscular, and we have a new agent that's out there that appears to have the ability to turn the human liver's ability to make vitamin C on again. It may well turn out to be the most significant supplement in the history of medicine. Okay, got a bunch more. So quickly on this, mop up vitamin C. Some people get sick when they take a lot of IV vitamin C. What do you do about it? Well, the last thing you want them to do is leave your office feeling sick, or they're not going to come back. But remember, they're sick because you killed a lot of cancer cells, you killed a lot of pathogens, or you got the vitamin C level so high inside the cell, you reduced a lot of oxidized enzymes and caused them to start detoxing. And so you're suffering from the presence of a lot of new toxins in your blood. So you know what the answer to that is? More vitamin C. But you give a lower dose and you give it slower. You give it at a lower dose and slower, so not a whole lot more is getting inside the cell, but you're just flooding the blood with vitamin C to neutralize the toxins that have been released, and it works like a charm. I mentioned this, iron and calcium. Now, our killer virus is Ebola. No problem. We have the documentation. It's easily curable by ozone, and in this particular case, ozone in combination with vitamin C and glutathione. Published. Not that you'd ever know that it was published, but it's been published. Same thing with chikungunya. I don't know how many of you heard of this, but it's probably one of the most clinically vicious viruses there is. I mean, it gives young people arthritis in every part of their body. They don't want to move. And a lot of times they keep that arthritis for months and even years. So it's a big time, horrible virus unless you're lucky enough to either get over it or die from it. But you don't want to keep it in your system because you're miserable. Anyway, high dose vitamin C. Matter of fact, with my wife, who's from Colombia, and a friend of hers who's from Colombia, they both had chikungunya. And I gave my wife a little IV push ozone, and she was better before the plunger was all the way down. And with her friend, I gave IV vitamin C. And when half the bag was in, she was amazed because her hand stopped hurting. So these are all exquisitely sensitive to vitamin C. Zika, no problem. High dose intravenous vitamin C treatment for Zika fever. Cures it just like it cures any other acute virus. Okay? So, any acute viral syndrome, remember the multi-C protocol, and I'm going to talk about this in a moment, nebulization with hydrogen peroxide. Store that away up there. I'm going to come back to it. Very, very important. Magnesium and zinc, hydration. And when you're dealing with somebody in the hospital and you have another pig-headed doctor taking care of your loved one, say, take a vitamin C level, please. And nearly always, especially in the intensive care unit, it's going to be low. It's going to be depressed. And you say, well, can you please treat my wife, my mother's, my father's vitamin C deficiency? I mean, since when, why should a vitamin C level test exist if it's going to document a deficiency and still not be treated? Okay? So it's easy to document, it's easy to treat, and that way, if you have at least a halfway open-minded physician, they can justify to themselves doing something that their other fellow physicians are not doing, namely doing the God-forbidden practice of giving vitamin C in the hospital. If you notice a little sarcasm there, it's intentional. All right. Magnesium, extremely important because vitamin C and magnesium work together as cofactors to bring oxidative stress down inside the cell. Sepsis, a lot of stuff out there, but vitamin C in very small doses resolves and stops the fatalities seen almost 100% of the time in sepsis patients, okay? Vitamin C works together with hydrocortisone, and bottom line is, and they did another study in all places of Iran. It wasn't a place I thought was going to be giving me new and exciting information in medicine, but I was glad to see that. So some Iranian researchers found that just giving 7 to 10 grams of vitamin C in divided doses, complete resolution of the fatal complications of sepsis. Now, I mean, some of those patients, depending on their underlying disease, they might get sick again and die, but as far as the acute septic state goes, vitamin C bails you out of it completely. And that's the formula. There's a reference number down there. All right. Now, chronic pathogen colonization. I mentioned this, body-wide, focal, and then you have this. Now, this is chronic pathogen colonization. Very important stuff. You need to take this away with you today. It's always growing in your sinuses, nasopharynx, oropharynx, deep down the throat, in your tonsils and lymphoid tissues, and in the upper and lower bronchial tree. For a long time, they thought it was abnormal to have any colonization in your bronchi at all. Quite untrue. It's normal, but it's a colonization with normal flora, but it's not sterile down there. And the biggie is the tongue. The tongue is one of the most grotesque reservoirs of chronic viruses, fungi, pathogens imaginable, and you need to have regular daily tongue hygiene if you want to normalize your gut flora. And you normalize your gut flora, everything else gets better. Now, nebulization. It moistens the inhaled air. It allows, number 2, a direct contact of the antipathogenic agent with the pathogen. Much lower doses are needed, so there's never really a complication of any side effects. Unless, of course, if you nebulize something and it's so irritating you start coughing, well, you use a lower dose or something else. So, I mean, you get your immediate feedback, whether or not it's something that's going to be uniquely aggravating to you. And number 4, it's a means of directly attacking and breaking up tenacious biofilms. Very simple. These devices cost about $40. All they do is just push air through there, and the little tiny thing it's attached to, a little vial, you put it in there and it just turns whatever you put there into a fine mist. Very simple. Don't need to go to a hospital to do it. Matter of fact, the hospital is going to screw it up and give you the wrong stuff. A little more sarcasm. Just like that. And let's say you're really convinced your nose and sinuses are fine and you're just feeling something brand new developing in your throat. You can go with a little mouthpiece and just go directly there. But in general, it's good to catch the nose and nasopharynx along with the mucosal surfaces around the back of your throat. Now, Hydrogen peroxide is very effective as an anti-biofilm and anti-pathogen agent. Okay. Go online, type in different ways to use hydrogen peroxide. You will be blown away. Okay. Hydrogen peroxide, well, to put it, is your body's natural antibiotic. That's how your body, inside, destroys pathogens. It's the body's antibiotic. So we're just following the body's lead here. DMSO, well, that's not a natural product, but it has much the same effects, okay? Ozone also does all this, but ozone is, of course, really tough on the lungs. You don't want to get it around your lungs. Ozone is what I call magic gas. It does everything you want it to do and nothing you don't want it to do. DMSO is magic liquid. It does everything you want it to do and nothing that you don't. The only problem with DMSO is, of course, you take too much of it internally, you get the garlic smell, okay? And availability. Quite easy. I mean, I don't know how it is in the UK here, but I order whatever I want on Amazon. They got it all there, okay? But you got to remember, if you get some DMSO, don't read the bottle. Bottle's going to say not for internal use, not for external use, not for any use whatsoever. Just take this bottle and enjoy it. Okay. But go into PubMed and type in DMSO, you'll see thousands of articles, okay? Okay, yeah, 5 minutes. Vitamin C and magnesium chloride you can nebulize. Also, a wide variety of things. Number 6, just don't inhale or nebulize fat-soluble or oily substances. Those tend to accumulate. Everything that's water-soluble is in and out, in and out. All right. Now, okay. Oops. A little sneak preview. What I'm going to tell you now is, in terms of the pharmaceutical or drug market, worth easily several $1 trillion, but I'm going to give it to you for free. You don't, listen to these words carefully, damn it. You don't ever need to suffer with a cold or flu or virus again. Never. All right? First signs of anything, you nebulize 3% hydrogen peroxide and it's gone. Okay? If you think about it too late, you've already had the cold for 3 or 4 days, well, then it's going to take a little longer. It'll take 3 or 4 days because of all the stuff that you've got already going. But you start to notice the little tickle in your nose, or everybody has a different manifestation. They run in the nose, they get a sore throat, it's gone. Okay. Now, there's other things you can do, combinations. I'll put together DMSO, vitamin C, magnesium, it all works great. But the quickest and easiest and most expensive, I think a pint of hydrogen peroxide costs 50 cents at Walmart in the United States. So it would only be able to treat about 100 colds. So more or less. Now, coronavirus. 2 words. Don't worry. Don't worry. It's just another virus, but it is very contagious. I'll give that to them. And because it's so contagious, it's going to kill a ton of people. And it's my own personal opinion. This is strictly opinion. It's going to get a hell of a lot worse before it gets better. And there is an outside chance that millions of people could die. But only because it's contagious, highly contagious, because modern medicine has no idea what to do with a virus. It's always go straight to a vaccine. Okay, boy, is that a big subject. I'm not even going to get into that. So, prevention. Obviously, you take a lot of... Prevention is staying healthy in a non-concentrated area. I mean, if somebody with coronavirus sneezes in your face, you're out of luck. You got it, okay? But if somebody sneezes outside and you walk past where they were 10 seconds later, and you got a lot of vitamin C on board, you're going to stay fine. Okay, so prevention. But cure or resolution. Conceptually, remember this. When you're treating a virus, influenza or any other virus, you're treating something that you got virus throughout your body. You got the muscle aches and pains, you got all this going on, you feel like crap, you got headaches, you got fever. But where is the virus replicating? It's not replicating throughout your body. It's replicating inside your oral and nasopharynx. Okay. So you nebulize with peroxide and you chop the head off the proverbial snake. And then the vitamin C and everything else mops up the rest of the virus that's already in your body, but you shut off the supply. You shut off the supply just like that. Okay? I'm telling you, anybody that's listened to this and doesn't order their own nebulizer right away, I'm sorry, I told you. And second choice, DMSO, vitamin C, magnesium. So, and remember, this applies to all colds, all flu, all viruses. Think of all childhood illnesses. So your little child or your baby gets measles, mumps. You get they have nice little pediatric baths too. You just might have to go lower on the dose of peroxide. Usually you use 3% straight, but it causes a little burning, and maybe the young one doesn't want to do that, so you use a little half dilution, works just fine. It just when you're with the little babies, you have to have suction devices available because you start causing secretion, so you have to be ready to suck them out. That's the only thing you have to pay any close attention to. And right now, guess what? China, believe it or not, is, last slide. China, believe it or not, in contrast to the rest of the quote-unquote modern world, has done a ton of research, not just on ridiculously low doses of vitamin C, but on many cases of not only sepsis, but ARDS, other things where they're using 20, 40, 50 grams a day. And now they've initiated a trial of IV vitamin C, 24,000 units a day, which is a suboptimal dose, but they're infusing it over a 7-hour period. So I think they'll see if the results are properly published and made available to us. I think we'll find a profoundly positive impact. And there's my email address if you want a copy of the presentation. If you have a reasonable question, that's fine. I can't do consultations or that sort of thing, but I'm perfectly willing to try to field 1 or 2 questions from people. Just some people think, though, that once you answer one time, then they could come back with 1 a day for. And then I say, then I get generous. Then I start giving away my ebooks. Say, don't write me back until you've read the book. Thank you. Yeah.
So I'm sure you will agree that was fascinating stuff. If anyone's got a quick question to ask now.
Thank you so much. What's the optimal maintenance dose?
Okay. Here the lawyer part's going to come out. It depends. No, seriously, everybody has a different toxin load in their body, a different daily toxin exposure, a different number of abscessed teeth, root canals, infected tonsils, all of those put you. So what I do say, though, is if you've never taken vitamin C before, then you start taking vitamin C and you start experimenting with the dose, you undergo what I call a greater realization of health. Okay? You function at a higher level and you feel really good, and when you've been at that level for X period of time, then you notice when something is hitting on your virus because you don't feel sick, but you're not at that peak anymore. And so the answer to your question is there is no direct answer. You sort of have to work that dose out for yourself, but for most people, it's going to be a multi-gram dose. It's going to be, at least 2 or 3 or 4 grams a day of regular vitamin C, less of the liposome encapsulated. Most people would do fine on 1 or 2 because those are actually the equivalent clinically of 12, 13, 14 grams of regular C.
You made your views about calcium very clear, but certainly I, and maybe other women in this room, are prescribed by our doctors.
In great error, but go ahead, yes, yes.
I thought you might say that. So, you know, to take a calcium supplement every day now for the rest of my life to protect my bones,
Which it doesn't, but go ahead.
which it doesn't. So if I wanted to stop that and take vitamin C, what would happen to my
Send me an email and I'll give you my ebook on death by calcium.
Thank you.
Okay? The short answer is magnesium, vitamin C, vitamin D, vitamin K, and iodine. Those are the big 5 supplements that everybody should be on. A lot of other good supplements, but you got to be on those 5.
You say that again. Sorry, can you say that again?
Magnesium, vitamin D, vitamin C, vitamin K, and iodine.
Great. Would you like to ask your question?
Just, yeah, I think you kind of touched on it, but I just wanted to really understand, because when you speak of grams, for example, one of these you're saying is 10 to 13 grams?
One of the Ultrients?
Yeah.
I'm saying the 1 gram of sodium ascorbate delivered in liposomes has the clinical impact, not blood level impact, the clinical impact of 10, 11, 12 grams of vitamin C, regular vitamin C taken orally. Largely because a huge amount of what you take orally like that isn't absorbed anyway. And when it does get absorbed, it's in the bloodstream unencapsulated, and energy needs to be consumed to get it inside the cells. So it's a clinical impact, yes.
So if someone is, for example, let's say you want to do a total body detox to try to get rid of anything in your body, whether it be cancer or beef immune, and you want to go on an extreme boosting of vitamin C, let's say you don't have access to do intravenous or C.
Sure.
Most doctors don't have the knowledge or the interest in that knowledge that you have. So for us at home, or for me, because I have a big social media following, and a lot of my followers ask me about this, and I've been following this for a long time. What would you say you should take per day, for how long, just to kind of do a nuclear cleaning out of anything from cancer to what might be in the body?
Well,
like 10 a day, or?
That varies a lot. I will tell you this, and I just came upon this just with my own personal experimentation, but I have found for myself that when I take 5 packets a day for a very long period of time, there was a time when I took 5 packets a day for several months, okay? And I detoxed a lot. I sweat a lot. I got funny smells in my urine that were unusual, all these different sort of things. I mean, I never did any chemical testing or urine testing or blood testing, but I could clearly feel that I was mobilizing stuff doing that. Which goes along with what I said earlier, is when you get enough vitamin C inside your cells, what happens? All of a sudden you start reducing detox enzymes that had been oxidized due to toxicity. You reduce them, they become active, and then they start mobilizing and kicking the toxins out of your cells. So, but I can't give you a formula for that. I mean, just
approximately 5.
yeah. For me, it was 5. For me, it was 5 packets. Yes.
And do any of those vitamins, for example, cross each other out? Because I know that some vitamins you can't take with other vitamins. So can you, for example, with all those, combine them together, or do they need to be spread out?
No, they're easily combined together, and if you're really good with the shot technique, you can take them all at once, or in a couple shots anyway. Yeah.
That's what I do in the morning.
Yeah, that's fine.
But I remember that like C and E or certain things cross each other out. So
Right.
I didn't know if that applied to this range.
No, that's no problem.
Okay, anyone else? Oh, there's lots.
Sorry, just a quick question. Mexico
Uh-huh.
stopped using the IV vitamin C, and I was just wondering if you knew what that was about, or...
No, I didn't know that.
Okay.
Yeah. Might have been availability. I mean, they're making it a whole lot harder to get C these days. I wonder why.
There's one question in the corner.
Is there a benefit to vitamin C if you're on immunosuppressants?
Absolutely, absolutely. It's interesting. There's no big studies done on this that I know of, but the theoretical concern for a long time about taking vitamin C if you have a transplant and you're on immunosuppressants, and isn't this going to stimulate your immune system to reject the organ? Well, there's a thread of logic in that. But in some animal studies, they actually looked at, I forget the species, I think it was rabbits with heart transplants. And there was another study with another animal, another type of transplant. But bottom line was, the more C they took, the less rejection that they had. You have to remember that the actual process of rejection is increased oxidative stress. So, but it does present a theoretical issue. I mean, I suppose if a family member had that and I was forced to directly address the issue myself, I'd probably, I'd have all their blood tests in front of me, all the indices, and I don't even know what they are off the top of my head on rejection, laboratory-wise. And then I'd just start on a few grams of vitamin C a day and make sure those indices weren't worsening.
And what about with arthritis? You mentioned that with,
I mean, what about it? What do you mean?
is there a benefit?
Oh, sure, absolutely. Well, let me throw you out a little taster here. It's now becoming apparent. I talked about the infections in the mouth. I talked about the infections in the coronary artery. It's turning out that probably most diseases are metastatic focal infection. I mean, now they've shown in Alzheimer's, for example, the actual tissue examined has the oral pathogens in it, okay? And practically all arthritis, I mean, certainly 100% of rheumatoid arthritis has the pathogens, the streptococcals, that sort of thing. The other thing, and I'll wet your whistle with that, is since it has to do with the oral that I talked about, we're now finding, well, there's a subset of patients when they get rid of all the infected teeth, and this was done in the 1950s, they would still have a lot of heart attacks. And as it turned out, when you've had a lot of infected teeth for a long period of time, even though your tonsils look morphologically normal, they're deeply and chronically infected. And so he started removing tonsils, the heart attacks went away. Well, we don't need to go straight to tonsillectomy, but very simple, very easy, direct ozone injections into the tonsils. About 2 cc's, takes 5 minutes. Any dentist that has an ozone machine can do it without any problem at all. And you do a series of those over the course of several weeks to a month, and you can pretty much completely detoxify a chronically infected tonsil because they don't detoxify and resolve on their own.
What was the problem with root canals? Is that to do with infection?
Yes, all root canals are infected, 100%. Send me the email with that note, and I'll send you an ebook of the toxic tooth. And if you want, death by calcium as well. Sorry, go ahead. Oh, hey, okay.
I'm going to buy myself a nebulizer. I snort pure ascorbic acid powder. Can you snort pure sodium sorbate?
Sure.
Lovely.
Sure.
Because you can't take a nebulizer everywhere.
And look, okay, do I have it on me? No.
And that was from the Lancet
Okay.
many, many years ago, a paper in the Lancet about inhaling.
For a long plane ride, or even if you're not on a long plane ride, I now have a Nice little black, it's designed for perfume. 3% hydrogen peroxide. So every hour or two inside the plane, go.
Thank you, everybody.
Okay, thank you. Whew.